Now, whenever this topic comes up, your prior podcast on Kevin MD, it evokes a strong reaction, which I'm sure that you've read and felt, right? So, what do you say to that counter narrative that the pendulum has swung too far against treating chronic pain, and you have patients who push back pretty hard against that narrative? What's your reaction to that response?
Yeah, they're absolutely right. I never advocate against giving opioids ad liberally to people with chronic pain. I did a TED talk. It now has 1.3 million views on how your brain hacks pain. And I got all of this pushback from the chronic pain, some chronic pain people, but I very carefully carve out in all of my articles and everything I do. If you've got chronic pain and you're maintained on a stable dose, cool, let that go. That's fine. If you want to wean, then a lot of these techniques will help. But if you don't, who cares? Those people are using all of their opioids. They are stably maintained. They are not letting opioids out in circulation, and they rarely overdose.
Mhm.
Why do we care? Let them have all the opioids they want. People misinterpret my desire to decrease post-op opioids and to decrease opioids in circulation as an attack against opioids and chronic pain.
Mm.
And I have always been very careful to carve that out. But again, it's complicated. And my being pro opioids in the OR and in the emergency room and pro opioids for chronic pain gets lost because it's simpler just to look at it as a yes no opioid binary solution. And it's just not.